Hi guys, this is Dr. Husain from Hope Medical Services. Today I wanted to talk about high blood pressure and how it can cause heart failure. So there's two types of heart failure. One is systolic and one is diastolic. Easy way to explain it, the heart has two important functions. One is squeezing. When it squeezes, it pushes the blood to the rest of the body. And one is relaxing. When it relaxes, it receives the blood from the lungs, the oxygenated blood, and then it squeezes it and pushes it. So relaxing and then squeezing. High blood pressure can affect both of these functions, and here is how. When our heart is exposed to high blood pressure, it gets thick over time as a response to the higher pressure. And I would compare this to, let's say, when we do dumbbell curls, where we put weight in our hand and we do the bicep curl, and because this muscle is feeling extra pressure and resistance from the dumbbell, this muscle gets thicker as a response to the higher pressure on it or the higher demand on it. Same thing happens in the heart. When the heart is exposed to high blood pressure, the heart muscle starts getting thicker and thicker and thicker. When it gets thick, it gets stiff. And remember, the one of the functions out of the two for the heart is to relax. So when the heart muscle gets thick and stiff, it's hard for it to relax and receive blood from the lungs. So once that happens, harder for the lung arteries to push the blood into the heart because it's stiff, and water can start accumulating in the lungs, and you get short of breath and you get heart failure, and you have to go to the hospital and they have to remove the excess amount of fluid from the lungs and you can breathe better. The second way it can cause heart failure is by causing heart attacks. Over time, as we spoke about in the past, high blood pressure can affect the blood vessels of the heart, and slowly or acutely they can cause clogging of the arteries. And when the arteries get clogged, the muscle that is supplying the blood to dies. And over time, if enough of the heart muscle dies, the heart gets weak, and that we call systolic dysfunction. And it can't pump enough blood forward, and what happens is blood gets backed up and fluid goes into the lungs and causes shortness of breath, and that's caused systolic heart failure. And then you have to go to the emergency room, and same thing, we give medications called diuretics that make you pee the extra water out, and you feel better that way. So it's very important to control and treat hypertension at an early stage so it doesn't over time adversely affect the heart in this way, and you can avoid heart failure.